Life Circles, my name's Taylor. I'm one of the registered nurses over here in the Holland Clinic. We were just hoping to make this video for you guys just to allow you to feel like you have the proper education on PPE usage, when to use it, when not to use it, what to put on and when, just to allow you to feel empowered to know that you are keeping participants safe and keeping yourself safe as well, so we can continue to provide good care to our participants. So first we want to talk about what kind of cloth mask can I wear. Acceptable ones here at Life Circles would be a cloth mask with some ear loops, an alternative cloth mask with ear loops, or a pleated mask that has a tying in the back. Types of cloth masks that we're not going to recommend would be a bandana or a buff. Those have been found ineffective to prevent you or our participants from the transmission of COVID, as well as cloth masks that have an expiratory valve. Those have been found ineffective to contain the respiratory droplets. So at all times, staff are going to be wearing the cloth mask while they're in the day space. The only time you can remove that would be as if you're in an office by yourself and that door is closed. You are in 6 feet within a participant, you're going to want to add a face shield to protect from any droplets, so you can contact your supervisor should you need one of those. As well, that's going to need to be disinfected between every use, both on the inside and the outside. And you can just use some type of disinfectant wipe or an alcohol wipe to properly disinfect that. For those of you making home visits, here are going to be a few things to keep in mind. If it's going to be an initial visit with a participant, you're going to be wanting to wear that cloth mask, the eye protection, as well as gloves. If that person does screen negative, then you're just going to keep on the cloth mask and the eye protection to provide proper protection to you and that participant. Let's say you go to that home and that participant fails that COVID screen and has one or more positive symptoms on that screening, and you've already gotten the confirmation from the provider. PPE use is going to look a little different. So now we're going to use a surgical mask along with gloves, along with a face shield, and along with a gown to provide proper protection to you and the participant. Let's say you have a participant that you're taking care of that has a confirmed COVID case. You're going to want to be wearing the proper PPE, so that's going to include a surgical mask, a face shield, gown, and gloves. You're going to want to wear it 14 days after their positive screening or 72 hours without a fever of greater than 100. Here's a couple facts that you should know about PPE. The surgical mask as well as the N95 mask can be worn up to 5 times. That's going to have to be worn by that same care provider, as well as the CDC defines one use as any time the mask is removed. So let's say you're wearing the mask, taking care of a participant, you go take lunch, so you remove it, you come back and you put that back on. That's going to be 2 uses out of the 5 that you're going to be allowed. Your cloth mask, you're going to want to wash that frequently, but at least after every 5 uses. K95 masks have no longer been found to be as effective as N95 masks, so should you have one of these, you're going to want to treat it as if you're using a surgical mask. Let's talk a little bit about transmission rates. Should you be in contact with a participant or person that is COVID positive that does not have a mask on, and you are wearing a mask, that's about a 70% chance of transmission. Let's say the participant is COVID positive, but they are wearing a mask, and you are not wearing a mask. That's about a 5% chance of transmission right there. So let's say the participant is COVID positive and they are wearing a mask, and you as well as staff are wearing a mask. That's only about a 1.5% chance of transmission. This is why we just continue to emphasize the importance of mask compliance, both for participants in the day space and homes, as well as you as staff. Let's talk a little bit about the order in which we should be putting PPE on. You're going to want to start with your gown. Make sure you're tying it securely in the back. Next, you're going to want to apply your surgical mask or N95, whichever is appropriate. Then you're going to want to put on the face shield, and finally after that you're going to want to apply your gloves. First, we're going to remove our gloves. Then you're going to remove your face mask. Then you're going to take off your gown. And finally, you're going to remove your surgical mask or your N95 mask, whichever is appropriate. When removing, you're going to want to make sure that you're not touching any contaminated spots when removing your PPE to make sure that you are not contaminating yourself once you've removed the PPE.